planetary health and human health cannot just be the responsibility of the healthcare workers or the healthcare system. It just can't be. It's not fair to them. They don't have all of the levers. They're incredibly powerful voices for paying attention to these issues, but they don't have the levers that are going to stop the hordes of people coming in through their doors that are being affected by climate change. So we've got to be looking at these other structural system issues, as well as greening the health system itself.
Hello and welcome to Planet Critical, the podcast for a world in crisis. My name is Rachel Donald. I'm a climate corruption journalist and your host. Every week I interview experts who are battling to save our planet. My guests are scientists, politicians, academics, journalists, and activists. They explain the complexities of the energy, economic, political, and cultural crises we face today, revealing what's really going on and what they think needs to be done. These are the stories of the big picture. Go to planetcritical.com to learn more and subscribe. My guest this week is Sharon Friel. Sharon is a professor of health equity at the Australian National University. She's also worked in international institutions around the world, researching and advising on this incredibly important topic, the interconnection between planetary health and human health. To begin with, Sharon walks us through what we can expect in a warming world. The health issues that are going to increase, the institutional shortcomings which will make dealing with them and treating them difficult, and how all of this is also going to affect our emotional and mental health. She explains how the healthcare system needs to change, and unsurprisingly, it's not just the healthcare system that needs to change in order for healthcare to be better. Sharon's work highlights how it is our housing, equity, natural spaces, green spaces, energy policy, economic policy, how all of these things either facilitate health or cause disease. And she walks us through how our health is being held back essentially by some of the policies that exist today, the influence of the biomedical paradigm on the healthcare industry, and what exactly needs to change in order for us and the planet to be healthier. From there, we discuss the necessity of a diversity of knowledge, the professionalization of the medical industry, how the medical curriculum can change at universities. Sharon explains what she sees now within young people, how they are much more attuned to this intuitive and instinctive knowledge, which is that, of course, our health is connected to the planet's health. And finally, she reveals what is going on in the health insurance industry, who are having lots of conversations about how many of us are going to become uninsurable in the future, and that the industry is about to cost them a hell of a lot of money. I hope you all enjoy the episode. If you do, please share it far and wide. And if you're loving the show, become a patron on Patreon or support Planet Critical with a paid subscription at planetcritical.com. By signing up, you'll get the Planet Critical newsletter delivered straight to your inbox every week. You'll also have access to the wonderful Planet Critical community, who are full of inspiring thoughts, ideas, critiques, and determination. The links are in the description box below. I'm so grateful to everyone who chooses to support the project. I'm a vehement believer in ad-free and open access content, so Planet Critical wouldn't exist without the direct support of the amazing community. Thank you so much to all of you who keep the project going every week. Sharon, welcome to Planet Critical. It is a pleasure to have you on the show.
Thanks a million. Delighted to be with you.
My very first very big question for you is, why is the world in crisis?
Well, so to me, the world's in crisis, and when I think of it as being in crisis, I think about the planetary health equity crisis, which we think of in the hothouse as the equitable enjoyment of good health in a stable Earth system. And all of that, of course, really is in crisis. I think a major driver of the planetary health equity crisis is what I've been calling the global consumptogenic system. This big system of policies, of institutions, of commercial activities, of power imbalances, of norms. That's, as you've spoken about on podcasts many times, this idea of sort of extracting baking in the extraction, the production, the consumption of fossil fuel goods and services, or fossil fuel reliant goods and services. These are very unequally distributed around the world, contributing to inequities, and they're also really bad for human health. So to me, I'd love to see how do we transform that consumptogenic system.
Absolutely. A very nice way of putting it as well. Really speaks to the core of the problem. Could you tell us globally, excuse the pun, but globally, how is planetary health connected to our own physical health? And do we have any sort of stats on that, comparing different peoples, different cultures? Because I think everybody can feel it in their bodies, even if we might not have the words for it.
Yeah, I mean, absolutely. I do most of my work on climate change. I know, planetary health is really a much, much bigger issue than just climate change. But if we thought of just climate change for the moment, so climate change gets into our heads, it gets under our skin, it affects our physical and our mental well-being. So think of the heat stress that people are experiencing around the world. That's causing us respiratory problems. It's causing us cardiovascular problems. We've just, here in Australia, actually just yesterday, we had the release of the National Climate Risk Assessment, modelling the future. And if we carry on in either a 2 degrees warming or a 3 degrees warming, even in a 2 degrees warming, we're going to see excess mortality from heat-related mortality increase by 200%.
What?
It's massive, massive.
That's huge.
So that's just the heat stress, that's up goes straight into our bodies. People who don't have the ability to get into air conditioning or don't have the ability to cool down in other ways. So being able to manage that thermal temperature stress is really important, and that's so socially graded. But there's also, if you think of what's happening in terms of the loss of biodiversity and the loss of the pollinators, then that's got massive implications, of course, for food security globally. So we've got just this ridiculous problem of undernutrition and overnutrition, and we might come back to that in a minute. So who's going to go hungry in terms of undernutrition? Who's going to go hungry? It's those who are already socially and economically disadvantaged. We see that taking place. The populations that are living in areas that are at risk of sea level rises, they're the populations that, and so loss of life from that, the mental stress that is associated with that, they're already the people who are living in housing insecurity. And we know that housing insecurity, stress associated with that is on an ongoing basis is much more likely to cause poor mental health outcomes. So it's just a little sort of snapshot of the ways in which climate change, planetary well-being gets into our heads and under our skin. So to me, the big thing is let's prevent damaging the planet. And that'll be one of the biggest preventative human health interventions that we can do. So to me, action on climate change is action on human health and health equity as well.
I had Peter Schwartzstein on the show, last year it must be now. And he was talking, he wrote this book called The Heat and the Fury. And one of the things he was talking about was, as you're saying, this impact of being too hot. And connected to the Earth's body, like the changes that people are going through. And for those people whom are still more connected, say, to Earth's body than we in weird countries, Western, educated, industrialized, rich, democratic, they're on the front lines of the climate crisis. They're witnessing the changes, and they don't really have a framework to make sense of the changes because it shouldn't be happening. And so all of their rituals and their customs and their models, essentially, that have kept them alive and kept them whole and cohesive as a culture are now no longer applicable. And so they are losing their minds, this mental stress of experiencing the worst drought in a generation 5 years in a row, of their herds dying, of not being able to grow their crops, of not being able to move to the parts of the land that they need to every year. They don't know what to do. And so they are, I think he said, they are coming apart with the land. And it is such a kind of heartbreaking and yet acute picture for me of how intimately intertwined we are with Earth's own body and well-being.
Yeah, totally. And one of the beautiful things about living here in Australia, where I'm based, is learning from Aboriginal and Torres Strait Islander friends, colleagues, communities. And absolutely, as you've just noted, that sense of a rupture, a feeling of rupture from the land, but also, which I think I'm a perpetual optimist. Really, the power of Indigenous knowledge and ways of being as just being so totally wholesome with Earth, with sort of planet Earth, and I think just really trying to harness, learn from all of those insights. Imagine being able to build that way of understanding into, and wouldn't that be fantastic, in some of the deliberations that take place in these fossil fuel companies' boards of directors. Actually, you're getting a different frame, a different way of understanding planet and people and that interconnect. And it seems, to me, that seems essential if we're going to break the harms that are taking place. So,
I agree. I agree. I think there's something very interesting, though, about the people who are in the boardrooms, say, in the halls of power, making decisions, although I'm not sure how much they are actually making decisions as opposed to just sort of ticking the boxes and going through the motions that their position demands of them. But the fact that these are the people that are kind of continuing us on this path of inequality, corruption, violence, abuse, change, biodiversity loss, and all of the harmful impacts that has on our health. And the fact that they are the people that have the resources to mitigate the impacts against on their bodies and will have those resources for the longest. Like, what does temperature change? How does it really bother you when you can go from your air-conditioned car to your air-conditioned home, to your air-conditioned office or whatever? Like, they're going to feel it last, which is so devastating because we need them to feel it first so that it doesn't consume the rest of us in the meantime.
Yes, exactly. Yeah, I mean, I think there was a story, not at the most recent fires in California, but I think it was the previous ones, and Kim Kardashian was able to bring in a private firefighting company. So, if you've got that sort of wealth, then that, of course, is exactly what is happening. But that's just not, I just don't think that's acceptable for us as a humanity. I think, again, I take some hope of the real generational shift in those ideas that are coming into the boardroom or to the halls of power. I've just, sort of a slight aside, I've just spent the last 2 weeks with a programme that we run. It's called the Planetary Health Equity Hothouse Future Leaders Programme. So, a young younger, certainly younger than me, cohort of people from around the world, from within government, previously from industry, from civil society, and, just really different ways of thinking, of doing, having a concern about these sorts of issues. So it strikes me that one of the actions that we must, as a humanity, as a sort of social collective, be pushing for is the elevation of alternative ideas. It's not just the idea that it's about the profits, or it's about business as usual, or it's about productivity and growth. It has to be alternative ideas, things like the well-being economy, things like the degrowth agenda, things like shared prosperity. These are different ideas. And then with that comes the creation of institutions, the rules of the game, basically, but the rules, the policies, the regulations that enable the flourishing of these different types of ideas. And that's, certainly in all of our work, it's that changes the game. It's that prevents exactly that sort of that power imbalance, that inequality from being maintained, because it's not those voices, or it's not those ideas that get to set the agenda going forward. So that's, to me, that's what we've got to work out, how we make that happen, and make it happen quickly.
Quickly, yeah. I have to say, I think I'm a bit of a cynic. I'm not sure whether or not truly we can make it happen. But tell me, what is this vision for healthcare? What could healthcare look like in a world that was maintaining its planetary boundaries, facilitating the regeneration of Earth, and giving adequate healthcare to people, and equitably shared, which is, we're going to keep coming back to that because that's very interesting.
Yeah, so healthcare is vital in all of this, because healthcare and healthcare workers, they're seeing the manifestation of climate change, of the degradation of Earth. Those colleagues are seeing people present into GP services, healthcare services, hospitals. I mentioned about the heat-related mortality, the heat-related presentations into hospital. So one, we need a healthcare service and system that recognises that the types of conditions, health conditions, physical and mental health conditions that are going to be presenting more and more and more are arising because of climate change and because of the degradation to Earth. So it's recognising that, and that means thinking about how do we make sure, and it's a sort of an ongoing question. It's been a question within the world of healthcare forever, of how to ensure access to quality healthcare, as you say, in that equitable manner. So, is that universal health coverage? Is it free at the point of delivery, which in many countries it is not. In some countries it is, and that we know is one of the biggest barriers to people presenting. So can you imagine if people are experiencing heat-related stress due to climate change, or the greater exposure to malaria or dengue as that changes around the world due to climate change? People won't go to their doctor, or they won't go to their primary healthcare setting if it's going to cost them a lot of money.
Yeah.
And, so we've got to get that right. But then at the same time, the healthcare system is a massive greenhouse gas emitter as well. But there's some really, really positive things happening in that space where, trying to green the healthcare system. A big initiative through the World Health Organization with lots of member states, lots of countries around the world really working out not using excess plastics, not single-use materials, reducing the amount of incineration that happens, the anaesthetic that we use, they're all big emitters. So there's real, at every stage in the chain within the healthcare setting, from really tertiary acute hospital services right through to primary healthcare, there's a real possibility to green that system. But I suppose, as I was alluding to, health comes from many other places. It doesn't just happen. Well, you go to we make use of the healthcare system when we're sick, usually, to keep us healthy, to keep us well. That's a matter of energy policy. It's a matter of economic policy. It's a matter of social policy. It's a matter of planning policy. All of the things that happen. It's a matter of food policy. So the actions that take place in those domains are going to help keep people out of the healthcare system. And especially in countries around the world, particularly in low and middle income countries, where those healthcare systems are already really under the pump, under-resourced often, and then that many of those populations in low and middle income countries with very large populations experiencing the brunt of environmental degradation presenting into the healthcare system, they're going to be even more stretched. So I do think we've got to think very carefully about improving the healthcare system and trying to keep people out of the healthcare system as well by attention to these other domains. I think of them as policy domains because that's where many of the levers sit.
It is sort of a problem with our intellectual tradition in the West of identifying symptoms as if they exist in and of themselves and as if we can just tinker around with them within a strict and contained border. And so, yes, normally when our, health ministers get up on stage at a conference and talk about health, they are talking about hospitals and diseases and healthcare and budgets, and they're not talking about a 4-day work week or reducing our pollution or taxing the wealthy and redistributing it so that people don't feel as insecure, or building more homes, or putting a rent cap, like all of these things that are going to reduce people's mental, emotional, and physical stress. That isn't normally what they're saying. And yet these things are also, they would also be hugely beneficial to the planet.
Everything that you just said there is a manifesto for physical and mental illness prevention. I would love to see, obviously the levers for those sort of things don't sit within the purview of a Minister for Health. But a Minister for Health can work in collaboration with the Labour Minister or the Environment Minister. That's their job, is to work in collaboration with them. There is no reason. And I honestly find it remarkable that that's such a hard thing to do. If the mission of government, the mission of the state, is about protecting people and the planet.
Well, it's not though, is it?
No, but it should be. And
yes,
the machinery of government will tell you that that's what they're supposed to do. But then we've got the issue of being captured by the private interests, and that's a whole other area that, unless that gets addressed, then the elevation of the mission of government for people and the planet will always be secondary to profits and productivity, and that has to change.
Yeah, absolutely. It's sort of, as people say, like, everything needs to change for things to change. You can't just sort of expect to just play around with A and hope you don't have to change B, C, D, E.
Yeah.
I think our governments are hoping that they continue their agenda of economic growth, even though everybody's forgotten what economic growth was originally intended for. And somehow not also cross planetary boundaries, and somehow also ask a population to work until they're 70 without that population getting pissed off, and and reducing people's pensions. And yeah, it's very obvious that this square peg does not fit in this round hole. And as you say, what would be good for people would be good for a wider environment. I'm curious as to what you might think about part of the history of how we got here, like the professionalization of our relationships. And so what I mean by that is, up until very, very recently, even in the imperial core, such as where you and I come from, Scotland, communities were still mostly responsible for their health, including their medicinal practices, and their rituals and whatever else. Now, obviously, I'm very happy that we live in a world where we do have things like anesthesia and antibiotics and surgery and the awareness of germs. But I wonder if there has been I wonder if you think whether or not there has been an enclosure of community knowledge, intuition, and oral tradition as well, that could also solve some of these problems.
Absolutely. And I think what you've gone to is really at the core of the crisis, but why is the world in crisis, is respect for diversity of knowledges, real diversity of knowledges, and and not seeing them in competition with each other. Again, sort of coming back to this, what sort of ideas get promoted or get into those rooms of power that we were sort of talking about. And that also relates to what type of knowledge gets privileged in those discussions. And you mentioned this idea of the sort of the professionalization. I'm no issue at all with professionalization as long as it is respectful of that diversity. There can be, there's some nice examples, I think, of diversity of knowledge being drawn upon based on community needs, and it puts the community needs front and centre. Again, I think of here in Australia where I live, where Indigenous, Aboriginal and Torres Strait Islanders knowledge is embedded in our the community-controlled health organisations,
Right.
Aboriginal community-controlled health organisations, and it's this lovely combination of a variety of different knowledges being used to treat, to support the Indigenous population's needs. But within I observe it all the time within the health world, is the biomedical idea, the biomedical paradigm is so strong. The biomedical profession is so strong. It's revered. It's looked to as the voice. And I'm not suggesting that's not appropriate, but it has to be fit for purpose. But what that does do is it shrinks the space for these other types of knowledges.
Yeah.
To be listened to be respected, to be considered worthy. And I think as a professional, or as professionals, making space, very deliberately making space for those other knowledges to be able to come into the conversation and to be completely legitimised.
it's sort of like a hangover from Descartes, whose perspective of all bodies as essentially being mechanistic, like clocks. You can put them apart, take them apart and put them back together, and their parts sort of function in and of themselves, not relationally in connection to the whole. That does seem to be ongoing, you might say, in the medical profession.
Well, I just think about all of the specialists, the specialists of different body parts, that sort of thing. But I do see, and certainly among the younger cohort of the medical profession, a much greater recognition of the whole, the whole body, but also the whole as in the people and planet. That's not as strong as it could or should be, but it's certainly moving in that direction. Part of the challenge is the incentives that are built in to these institutions are not currently recognising, rewarding, all of that. So that's where some of those institutional reforms become really important. Even simple things like, well, not simple, it's transformative, I think, but in the medical curriculum, thinking about or having core competencies that connect the natural environment with the human body and seeing them as a whole. Yep. Wouldn't that be transformative to the biomedical paradigm?
Yeah, I mean, of course, I'm just immediately like, it would cause a lot of problems though, wouldn't it? Because once people start to see the Earth's body as a part of the human body, or perhaps rather human bodies as part of Earth's body, then you're in a bit more of a difficult moral position to go off and mine her and deforest her and shave her and take her and pollute her. And then pretty much all of modernity comes to a grinding halt.
Well, and it is that question as well, I think, again, at the core of what you're saying of the relational aspect between humans and Earth, and in an understanding of that, where is primacy given, and certainly what we see with land, sea, air, it's all about trying to put a border around it so that it has some property rights, which then has some value, monetary value. And you could imagine, and that is what happens within the world of holistic medicine, that starts to take place as well. So yeah, I mean, that at a theoretical level, wouldn't it be fantastic? At practical level, all of the caution that you've just pointed towards.
Yeah. How do you find policymakers are when you broach this? Are they open to it, or close to it, or somewhere in the middle, in that it makes intuitive sense, but they've got absolutely no idea how to get it through the door?
A real mix, all of the above. Some colleagues, my experience of people within the bureaucracy, within that machinery of government, is many of them are really, really pushing to advance a progressive policy agenda. There are a whole load of institutional challenges to that. So you've got the individual values want to do something progressive. And then you've got the institutional challenges. You've got all of that kind of baked in path dependency of, we did it like this before, this is how we're going to do it going forward. You've also got the gatekeepers that exist in a bureaucracy, and at those levels, those positions of power, that are trying to manage their political masters, then whilst there might be incredible and positive intentions in the bureaucracy, moving it up through the system, there's blockages. There's also just that kind of everyday churn that is just nonsense busy work that colleagues in the public service tell me that, they have, the fact that you have to get 10 signatures on a piece of paper to move it through the system seems remarkable to me, given what else those people could be doing. And then I think a very serious issue is the capture. So not just that sort of political capture that takes place, but the bureaucratic capture, and how both in terms of the material nature of that, but also the ideological capture, that when the lobbyists are there speaking to the bureaucrats, putting ideas in their head, I say that in inverted commas, but that really is what they're doing, then that normalises those issues. So I have a lot of time for my colleagues in the bureaucracy who are in the main trying to push progressive agendas, but there are all of these institutional roadblocks that they just experience on a daily basis. And I think my job as somebody on the outside, as an academic or as an advocate, my job is to help them push that agenda, so for us outside, being loud and noisy, saying this is an issue and this is what can be done and this is how it's good for government to move it forward, and this is how they could do it. It becomes an important part of our role.
What about doctors? What about those within hospitals or within the healthcare workers? That's what I'm looking for.
Yeah, I mean, the healthcare workers have such an important role because they're such trusted voices.
Yeah.
They've got real authority, real moral authority, trusted voices, trusted in the community, and certainly trusted among politicians and the bureaucracy to speak about exactly this relationship between, as I've been saying about climate change and health. And it's been fabulous to see in countries around the world and then at that sort of global level, these alliances of climate and health, doctors for the environment, for example. So those voices really matter, really, really, really matter, saying, come on, we need attention to these issues. I have to say, here in Australia, I think one of the reasons that we're going to see quite a significant investment in this heat-related mortality figures that I was talking about is because of the power of the doctors in being able to stand up and very eloquently and with that sort of authority saying the heat stress that people are experiencing in Australia is causing such pressure on the healthcare system, and that cost to the healthcare system is going to blow out the whole government budget, not just the healthcare budget, the whole budget. And then that's gotten attention of our Prime Minister, etc. So doctors, not just doctors, healthcare workers have such an important role. And they're also incredible interlocutors as well, because they're talking with patients, which is all about creating public demand for action on these issues, talking out in with the community, and the community then going back saying, okay, we need to do something about climate change, and pushing up for that sort of action. So they've got a really important multiple roles to play there.
Any sort of resistance to the idea of Earth's body being just as important to the health of our own as the decisions that we make about our lives?
Oh, yeah. Yeah. So on one hand, there's an instinctive understanding of it. But then there's two reactions, well, certainly that I've observed. One is we can't possibly add anything else. There's just so much that we've got to address when you're talking in terms of health care and yeah. So we just can't pay attention to that as well. But then the very strong worldview, the very strong idea that it's about individual responsibility.
Oh, interesting. Yeah. Yeah.
And so it's about our individual choices. If we make bad individual choices, then it's our fault, etc. But there's no evidence, of course, to support that. We know that individual choices are so shaped by our wider physical, social, and natural environment. But yet, and it's a very powerful narrative, it gets used all the time to deflect government intervention, so this narrative about the nanny state coming in and intervening.
Deflects collective responsibility.
Yeah. So you've got that plus, it's not something else that we need to try and squeeze into the curriculum, squeeze into our daily practice.
Wow, that is so interesting. I don't know what that speaks to, how absolutely overwhelmed our healthcare workers must be, probably, actually, to feel that they actually don't have the space or the time to address the root cause. Yeah, actually, that's the sort of first thing that comes to mind.
Yeah, sort of the sense, healthcare workers are some, like many frontline workers, they're incredibly busy all the time. It's every minute, every second, every minute, it's action. So yes, there's the business aspect of it. And then there's the cognitive ability to put the earth, climate change into the mix as well. But as I say, many of them are, and there's a growing recognition and attention to that. It also comes back to what I was saying earlier of why I would love us as a kind of a global society to really recognise that paying attention to planetary health and human health cannot just be the responsibility of the healthcare workers or the healthcare system. It just can't be. It's not fair to them. They don't have all of the levers. They're incredibly powerful voices for paying attention to these issues, but they don't have the levers that are going to stop the hordes of people coming in through their doors that are being affected by climate change. So we've got to be looking at these other structural system issues, as well as greening the health system itself.
I would have thought health would be a huge narrative bonus, if you will, across the political spectrum. I mean, it is a bipartisan sort of political issue, both sides of which have a huge amount of support for. And that the public as well, even if we don't always make the healthiest choices, we do tend to be very invested in the conversation around health.
Absolutely. And especially when you put the health equity aspect or the intergenerational health and equity. If you think of climate change now is going to maim and prevent future generations from living a healthy life. That's very powerful, and we've seen that be powerful. So the health dimension, that relationship with planetary and human health, absolutely is getting like strong discursive narrative cut through. But where it's landing is on adaptation measures.
Okay.
So it's about, okay, well, how do we help communities be more resilient to climate change? That is vitally important. So how do we ensure our housing is adapted to be responsive to the climate change that is locked in? Or how do we think about urban planning? How do we build more green space or ensure more access to green space? It's going to help reduce heat stress. It'll help people adapt to climate change. Or one of the best, ridiculous things is building more shopping malls.
What?
Well, building more shopping malls gives more people access to air conditioning.
Well, hang on.
In a
What about
heating
more
world.
parks? What about sorry, but
Oh yeah. But then you're taking on all the developers who want the land for building. So that's that's what I mean of where it becomes it gets positioned in an adaptation way. And I'm not saying that's not important. It's very important. We've got to deal with the damage that has been done to Earth that is impacting on humans. We've got to deal with that. But
you can't skip the mitigation stage, though.
Yeah, you can.
Yeah.
And I'd say mitigating further environmental destruction will prevent more of this happening in now and into the future. So that's why I'm saying, mitigation is the biggest preventative health intervention we could possibly have. But where I see that landing is, okay, well, we're going to green the healthcare system. We're going to stop the emissions in the healthcare system. Yeah. And I would love the climate and health or environment and health people to be having a discussion about, actually, we need to change our economic system. We need to think about our energy policy. We need to think about our food policy. We need to think about, but from a mitigation perspective. And that's going to have profound health benefits now and for future generations.
Are you having any conversations with people in the health insurance industry who are either thinking that the potential chaos is going to be an absolute financial windfall for them, or that their industry is going to become uninsurable as people do get sicker and they are going to lose lots of money and start to limit the access that people have to certain things by virtue of it being in the future unavoidable, such as, lung problems because of pollution, etc.
Yeah, it's a very real conversation, a live conversation there. And within the insurance industry more broadly, but also within health insurance. So they're seeing, exactly as you say, the health insurance world, they're seeing this is going to end up costing a lot of money for us. The insurance sector more broadly is saying this is going to end up costing us a lot of money, really a lot of money. And in fact, some of the really interesting conversations I think that are taking place, those unusual bedfellows of discussions, collaborations, is in the actuarial world alongside the climate scientists. And they're saying, yeah, this is a very serious, we've got to be in our insurance calculations and related to our investment decisions. We're going to have to take a long-term view, not just the short-term windows that they might otherwise have operated on. So I think that sector, that insurance sector and the health insurance sector is going to play quite an important role in trying to get some really radical, transformative change in a way that, we mightn't have been seeing those conversations probably even 5 years ago. They would have still been really much more fringe conversations.
Well, what's being discussed in the health insurance industry with regards to this upcoming problem?
There's two parts to it. One is, are we going to be able to insure individuals if they're living in areas that are going to be much more at risk, health risks from climate change impacts? So that's a very serious problem for us as individuals trying to get health insurance. That's where I'd love us to see the government step up and say, well, actually, we're going to underwrite that risk because it's a universal provision of health insurance. So it comes back to that equitable access to insurance. But at the same time, they're also saying, let's use our voice, because the health insurance industry are investors. They make their money, they build their capital through investment portfolios, and they're using their voice and saying, we're not going to, or we're recommending not to invest in fossil fuel industries, for example.
Really?
Yeah, they're live conversations. So that's really, to me, that's really powerful, because the health insurance industry is a massive, massive investor globally, billions and billions of dollars globally. So if they're starting to divest from fossil fuel, the industries, that sends a signal to the wider investment world, where they're already starting to think about, the long-term returns are really pressured. But of course, they're still in the mindset of it's a 3-month return cycle that they're thinking about. But they are, some are starting to say we're going to have to think much longer term, because we're going to end up with all of these stranded assets from fossil fuel projects. So the health insurance industry are playing a role in that. I'd love to see that across the board. But, there's glimmers of hope.
I think it's the one industry that I do have hope for. Like, when I really, really think about industries today and what they stand for and what they were made for and their bottom line, and like also the kind of legal pressures that they have to fulfill a certain directorate, and it's all the same. The one for me that stands out is the insurance industry, because it is their job to model risks and do risk assessments and find a way to mitigate against risks and not shell out cash when they don't have to. And so if, for me, the world becomes uninsurable as it is, then things will have to change, because people won't be able to build homes, or better than homes, build the shopping mall or the airport or fly the plane or do any of the stuff that our big world needs in order to keep ticking over. So I'm always very excited to get news that things are happening in the insurance industry. So thank you for passing on what's happening in the health insurance industry.
No, any little bit of hope, any glimmer of hope, I think very important, because that can ripple, out as well. So it's, I think it's important that can diffuse. And part of the question is, what are the conditions that enable these regressive actions to diffuse out much more widely?
Yes, absolutely. Sharon, my final question for you is, who would you like to platform?
Oh, there's so many wonderful people. Somebody like Catherine Trebek. If you've come across Catherine?
No.
Catherine was one of the co-founders of the Global Wellbeing Economy Alliance. She's an Australian, but works at that global level. Actually lived for many years in Scotland. I didn't know her when she was there, but yeah, we crossed paths as we were moving continent. Catherine is all about economic change, and really how to think about economic systems that are in service of people and planet.
Wonderful. Well, that's our jam. Sharon, thank you so much. This was really enlightening, and I'm really grateful for your time.
Oh, delighted to talk with you. Thanks very much.
If you want to learn more, I've put links to everything in the description box below. Remember to subscribe to the channel if you're new here and share the episode if you enjoyed it. To support the show, subscribe at planetcritical.com, where you can read the weekly newsletter. You can also become a Planet Critical patron. All links are in the description box below. As always, my deepest thanks to that community. Planet Critical wouldn't exist without your support. Thank you everyone for listening and for coming on this journey together.